everyone, my name is Pooja Chaudhary and I'm a trained yoga instructor and practitioner. I have created this YouTube channel so that I can share my experience with you. My today's topic is breathing. Now you must be thinking, out of all the great asanas that I perform, why I chose this boring and dull topic for my very first video. So, I would like to inform you that breathing is actually the most important key element for our health and fitness. Most of us actually don't breathe correctly and take this for granted all our life. Just by correcting our breathing pattern, we can solve more than half of our health issues, either it's hair fall, acne, deep-seated pain, or you name any disease. Trust me, it can help you in curing that disease. No matter what asana or pranayam you do, if you are not breathing correctly, trust me, you can never get 100% benefits of doing those asanas and pranayams. So, by the end of this video, you'll know 3 very easy techniques by use of which you can actually improve your breathing pattern. Now you must be thinking that, do I breathe incorrectly? So I'll tell you 7 signs, and if you have any of those signs, then my friend, you are breathing incorrectly. First sign, you inhale with your chest. In this, what you have to do, just inhale and see. If your chest is the first thing that moves, typically this movement is your chest is slightly going forward and going up. If this happens, then it is a sign of shallow breathing. Sign number 2, you are breathing from your mouth. Even if you are not exercising and commonly you have your mouth open when you breathe, then this is not good. Unless you have sinus infection or congestion that keeps you from breathing from your nose. Otherwise, breathing from nose is normal. Okay, so sign number 3. You have your upper neck muscle, your shoulder muscles and your chest muscles really tight. Do you carry a lot of tension in these muscles? So, when you get a massage and reach back, you feel a little tension or pain in these muscles. If so, then you are engaged in stressful and shallow breathing. Sign number 4. Your ribcage doesn't expand to sides. In this, place your hands on either side of your ribcage, and when you inhale, your ribcage expands to sides by approximately 1 to 2 inches, and if there is very little expansion or no expansion in your ribcage while you inhale, then that means you are engaged in shallow breathing. Now, sign number 5. You have very high resting breath rate. So, for a normal and relaxed person, this resting breath rate is 10 to 12. And if you want to measure this, so this resting breath rate is how many times you are breathing in a minute. And if it exceeds 12, then it means your breathing pattern is quick and shallow. Then sign number 6 is if you sigh or yawn frequently. So, if in every few minutes you feel the need of taking a deep breath or sigh or yawning, then that means your body is not getting enough oxygen by your breathing pattern and you need to change that. Okay? So, sign number 7 is you slouch forward. This problem is actually very common in people working in MNCs because they tend to sit for longer hours because of their work. So in that, due to they slouch their shoulders and head forward, it actually restricts their normal breathing pattern. So now you must be thinking that what if I am not breathing correctly? Don't worry people, there are ways by which you can improve your breathing pattern and live a healthy life. Now I'm going to disclose those 3 techniques by which you can actually improve your breathing pattern. So the first technique is to limit your shoulder movement. For this, sit in a chair with your arms and elbows supported by the arms of chair. In this, when you inhale, push down the chair with your arms, and when you exhale, release that pressure. Okay, so you have to repeat it at least 15 to 20 times whenever you have time. Okay, and there is no limitation, like you cannot do this after eating or before eating or like any time. You can actually perform it any time. Second technique is abdominal breathing. To practice this, lie on a flat and firm surface, but your bed is not firm, so don't practice on your bed. And if it is firm, then you can practice this. So yes, when you lie down, close your eyes and place your one hand on your chest and another hand on your belly, on your lower belly. And when you breathe in, consider your stomach as a balloon. So when you breathe in, inflate it like a balloon, like you're filling your all the air in your belly. And when you breathe out, deflate it. Your hands will regulate the movement of your stomach. Like when you breathe in, it goes out, and when you breathe out, when you exhale, it goes inside. Okay, and repeat this at least 15 to 20 times, and you can do it every time. And if you have really busy schedule, then you can do this just after waking up, or you can do this even before going to bed. So then third technique is my favorite, which is simpler version of Bhrabari pranayam. How to practice it? Sit in any comfortable position. Make sure your spine is straight, and then what you do, just close your eyes and take a nice deep breath, and then produce the sound of hum. Take a deep long breath. This practice actually produce a calming and soothing effect on your brain, and practice it every day. I personally practice it every day without a miss, because this shows phenomenal effect on your whole body. So please practice all 3 asanas, and now I'm going to give you 3 tips by using which you can actually improve its efficiency. First one is always breathe through your nose. Second one is choose your place where you practice very wisely. It should be well ventilated, and don't do this in air conditioned area. Avoid it. You can do this, but avoid it, because oxygen level is not that great in air conditioned room. And third is practice it every day. Show consistency to see the results. So that's it for the day. I hope you like the video. So see you in my next video. Till then, bye bye.